Hi Sam,
Hey.
thanks for coming to see us today. So, as we talked about on the phone, you've come to see us for some EMDR today, and particularly to work on a difficult experience that you had recently. Yeah. But before we get into that, I just wanted to understand a little bit more about your background. So, remind me again, how old are you?
I'm 31.
31. Okay, that's good. And what do you do for work?
I work as an actress, so like live immersion theatre, bit of film, that kind of thing.
Yeah, that must keep you quite busy.
Yeah, it does.
Okay, so what kind of things do you normally do to relax?
Just like general, like watching Netflix, maybe reading a book. I do a bit of costume making as well, so sometimes it's working on bits and bobs like that.
Okay, so that's really important to remember because these sessions are kind of quite tiring at times, and it's always nice to have something nice to do at the end of each appointment, and I'll remind you of that afterwards. Yeah. Thanks for that. That's really helpful. So if we could go into what's brought you into clinic today, please.
Okay, well, as I said earlier, I'm really active like with my acting, and I'm wanting to train for the stunt register. However, about a year ago, I was training for my high diving, and I unfortunately had a really bad accident where I entered the water wrong, and the force of the water was on my neck. And since then, I've not been able to combat heights, which is it's for my line of work. It's terrible because I need to be able to jump out of planes and jump off high buildings and snowboard, and it's really been affecting my work, and if I want to be able to follow the career path that I want, I need to be able to get this sorted.
Okay, so it really does get in the way of your acting work.
Yeah, it really is.
So that's really helpful, Sam. So when we spoke on the phone, we talked a little bit about EMDR. So what I'm going to do is just kind of go through some of the key points again with you, just to remind you, right? So as we were saying when I spoke to you on the phone, one of the things we think about is when we have anxiety or kind of traumatic experiences, often our memory kind of gets jumbled up. And I often think about it like a metaphor of like a library with some of the books out of place and the rest of the books in perfect order. Yeah. So what EMDR helps us to do is kind of literally kind of put those memories back in. And the way we think about memories is a bit like a chain, so one memory is kind of linked to the other. And that's what the reprocessing is about. So it's about you being able to kind of think about the difficulty or do the difficult thing without having the anxiety. What we'll do is we'll go through some of the EMDR preparation, and that's what we're going to do for the first appointment today, right? And this is just a technique to help you to close off an EMDR session and also to manage your anxiety through the week. Yeah. Okay. So we're going to start off by doing some breathing work with you. So we'll start off by just doing some diaphragmatic breathing. So what I want you to do is kind of breathe from your belly. That's good, right? So take a deep breath in for me. That's good. And breathe out. Wonderful. Okay. So that's going to be the first step of the relaxation technique that we use today. The second one is I'm going to ask you to imagine that you're on a step of 5 steps, right? And as you go down each step, you're going to start to feel more and more relaxed, right? And then at the bottom of the steps, there's going to be a big door. And behind that door is going to be a safe place, right? And then we're going to just spend some time exploring that place, right? Okay, so it can be a place that you know really well, or it can be one that you conjure in your mind. And what I'm going to ask you to do is keep on practicing this between now and our next appointment. Okay? Right, so if it feels okay, and sorry, after that I'm going to show you some eye movements. So what we're going to do is we're going to kind of show you how the hand movements work as well. Okay, so we'll just roll it. Okay, so if it feels okay, just close your eyes, right? I'm going to take a nice few deep breaths in your own time. That's great. Okay. And so as I count down from 5 to 1, I want you to imagine yourself walking down those steps and through that door. Okay. So ready? 5, 4, 3, 2, 1. Okay. So now you're at the beginning of your safe place, and I want you to walk through that door and close the door firmly behind you. Okay. So just to start off with, if you could just pay attention to the different things that you can see. So what can you see there?
I'm in the middle of a wood.
Great.
It's a clear, starry night.
Beautiful.
There are candles and like fire torches all around, and in the middle of this large circle there's like a big, like massive kind of like open like bed with loads of cushions and soft things and like really fluffy duvets and all that kind of stuff. Just really comfy.
Tell me a bit about the colours that you can see.
All the cushions and the blankets, they are all white, but glowing with the soft orange glow of the fire that's around it.
Lovely. Okay. And are there any other people there, or are you on your own?
I'm on my own.
Great. Okay. And as you gently, just kind of curiously wander, tell me about the different things you can hear when you're there.
I can hear the soft rustle of bats flying through the trees.
Oh, nice.
The slight hooting of an owl, the very kind of soft sound of the wind flying through the trees.
Okay, so soft sounds.
Mm-hmm.
Okay, and is there any music playing, or anything like that?
No, it's just the sound of the outdoors.
Okay. So now let's think a little bit about what you can smell when you're there.
I smell the smell of fresh pine.
Great.
The slight aroma of the burning wood, sandalwood,
Okay.
I think, from the torches. Slight dampness of the soil.
Okay.
Nice outside smells.
Outside smells, that's great. Okay. And can you taste anything when you're there?
It's only recently been raining, so you can't really taste it, but you know that kind of smell of fresh rain? That's kind of lingering in the air.
Okay.
So you can kind of slightly smell and taste it if you get my drift.
Great. Okay. And now talk me through how you're feeling when you're there. Both physically and emotionally. So what are the different textures that you can feel?
Well, as I'm walking up to this kind of soft lounge space, I'm barefoot.
Okay.
I can, for starters, I can feel like the soft kind of moss and kind of twigs underneath my feet.
Yeah.
Then stepping up onto a nice wooden platform.
Okay.
And then just flopping down onto this huge white fluffy bed,
Okay.
and just feeling like the softness of like the duvets and the pillows, and just looking up to an opening in the trees and just seeing the night sky.
Wonderful. Okay. So, and if you were to put an emotion to how you feel there?
Stillness.
Stillness. Okay.
Calm.
Calm. Okay. That's good. So I want you to remember that word calm, right? Okay. So we're going to gently bring you back to the room.
Mm-hmm.
Okay. So I'm going to ask you to slowly walk back to that door in your own time.
Mm-hmm.
Tell me when you get
Yeah, I'm at the door.
there. Okay. And I want you to just remember that that safe place is yours. You're the queen there, right? And you can always go there whenever things get too difficult. Yeah? Okay, so I want you to gently open that door,
Mm-hmm.
walk through, okay, and close the door firmly behind you. Okay. Right?
Mm-hmm.
Now that feeling of calmness that you have, right, where can you feel it in your body?
In my fingertips.
Okay, so I want you to really focus in on that feeling now,
Mm-hmm.
right? Okay, And then I'm going to ask you in a second to open your eyes, and we're just going to do some gentle eye movements. So what I'd like you to do is just follow my fingers. Yeah? Okay? So ready? In your own time, when you're ready, open your eyes. Okay, just focusing on that feeling. We're going to start working with the difficult experience now. So what I'm going to ask you to do in a second is actually think about the worst possible moment of that experience where you were jumping, right? And I'm going to ask you to bring it into your memory, into your mind, sorry. And then I'm going to ask you where you can feel it in your body, right? And then I'm going to ask you to focus in on that feeling whilst following my fingers. And this time my hand's going to go a lot faster, right? Okay. And then I want you to just kind of let your mind roll and see what happens, right? It is very normal for your mind to kind of go from one memory to another, right? When I think you've kind of switched, I'm going to stop and we'll kind of ask you what's going on, then I'll say go with that, so you just go with that and then keep on going, right? The idea is that basically we're trying to explore the different channels. So this is like the big memory over here, and each of those memories, like I was saying before, is linked to something else, right? Okay. The other thing we should probably agree is a stop sign as well. So if the exercise kind of gets too intensive for you, would it be okay to ask you to just put your hand up and say stop?
Yeah, sure.
Yeah? Okay. I may push you just a bit longer just so that you get to the end of that and I can leave you at a safe place.
Okay.
Yeah? Okay. So if you just close your eyes for a second, right? And if you can just recall that memory, okay? And now tell me about the worst possible moment in there and bring that frame into your mind.
So, it started off normal, position was right, and the worst part of it was just as I hit the water and I felt the full force hit me, like I just hit my head on a massive piece of concrete, and the full weight of that water had crushed kind of my neck, and for that split second I thought that I had broken my neck and then I wasn't going to be able to come out of that water.
Correct. So that's the frame that I want you to focus in on, right? Okay. And if you had to put an emotion with it, what emotion would that be?
Terror.
Terror. Okay. And where are you feeling that terror in your body?
Down my neck and to my right shoulder.
Okay. And if I was to ask you to rate it where 10 is the worst possible and 0 is the least?
I'd say probably about a 7.5 because obviously at the time I had to try and get out of the water as well, because I didn't know how bad it was at the time. My main focus was to just get out and get air.
Okay. Alright, so we'll go with that. So if you just follow my fingers for me, yeah?
Yeah.
Okay, ready? Here we go. Okay. So remember you're recording that memory that you had, yeah? Okay. Okay. So it was the feeling of terror, right? Okay.
Yeah.
So what I want you to do is just recall that freeze frame of the worst possible point, right? And bring it into the forefront of your memory, okay? And then when you're ready, I want you to open your eyes, okay? And I want you to follow my fingers, okay? And just let your mind freely go where it wants to go, yeah? Okay, try not to suppress. Okay, ready? Let's go. Okay, so what came up for you there?
Well, the first thing was the concert I saw last night. I saw a violinist called Lindsay Sterling last night in concert, which was really good. Also thought of a time when I was a child at Disneyland, just like going on my first roller coaster. Oh, I don't remember very I used to actually do some jousting, and I just had the memory of actually being at one of the jousting shows.
Okay.
So yeah, just lots of fun. I just had lots of kind of fun recently.
Okay. So if we go to the roller coaster memory,
Yeah.
right? If you kind of recall the scariest point of that roller coaster for you, yeah.
Mm-hmm.
Okay. So bring it to the forefront of your memory.
Mm-hmm.
Okay. And I want you to follow my fingers and stay with that. Yeah.
Mm-hmm.
Ready? Okay. What came up there?
Just the sense of excitement, at the thrill of how fast it was, and then the kind of like intense achievement I felt that I had actually been brave enough to do it.
Okay. All right. Okay. Did anything else come up?
As in visually, or
Visually, yeah. Were there any other freeze frames?
just lots of people with their hands up enjoying themselves. Just the sound of like excitement and screaming at the same time. Just the kind of like the general kind of thing that you'd hear when you're on a roller coaster, and just the scenery, because it was Thunder Mountain, so
Okay.
just the look of the all the mountains around you itself, and being able to see like the rest of the park, especially when you got to the highest point of the ride itself. You could see
Okay.
the haunted house, and you could see the lake,
Okay.
and yeah, just so many exciting things to look at, while at the same time knowing that you're going to plummet really, really fast.
Okay. And what emotion would you put with that?
Real excitement, anticipation, slight bit of fear, but the good kind.
So Sam, what we were going to do now is kind of go back to that memory of you when you were diving.
Mm-hmm.
Yeah. Okay. So can you just remind me again what the memory was?
So I was just practicing a back fall, so when you fall off the diving board backwards, so you can't see the water until the very last minute, and I'd entered the water incorrectly, and the full force of the fall had my head had hit the water first instead of my arms, and I felt a crunch in my neck, and I thought at that split second that I'd broken my neck.
Okay. So if we think about that freeze frame of where you felt the crunch
Mm-hmm.
and you thought you'd broken your neck, what emotion would you associate with that?
Panic.
Panic.
Like terror.
Okay.
Yeah. Just fear of the unknown of in that split second.
So if we think about the panic and the terror, where can you feel it in your body?
I can feel it down the right side of my neck.
Okay.
And the right hand shoulder.
Okay. And if we were to rate the intensity, so from 0 to 10, where 10 is the most and 0 is the least ever?
I'd say probably a good kind of 8.5.
Okay.
Because at that time I was also underwater as well. I didn't know if I'd be able to get back out again. So it was a very deep pool.
Okay. So we're going to just remember. We're going to bring that memory of you and feeling that crunch to the forefront of your memory, and you're going to follow my hands. Yeah.
Okay.
Okay. So can you see it? Good. Okay. Let's go. So what memory came up there for you?
That one was actually a trip to Disneyland. Actually, it was kind of like my first big theme park ride.
Okay.
And I can just imagine. I can just remember how scary it was, especially as we were getting higher and higher and higher.
Okay, we'll go with that. Stay with that. Focus in. Follow my movements.
party.
Okay.
I've come alone to it because I was meeting some friends there. It seems like a fun night, but at the same time, because I kind of went on my own, it was quite scary. And I feel like I want to be there, but at the same time, I really want to run away because I don't like being by myself.
Okay. It's that sense of us wanting to escape.
Yeah.
Okay. Let's go with that. Okay. Where are you now?
I'm in the pub, actually, with my best friend. We're just having a beer, having some food, having a catch up, just talking about work, life in general. It's quite nice and quiet. It's not too busy in there, not too many loud noises. Yeah, we're just having a bit of a giggle.
Okay. And what emotion have you got coming with that?
Just relaxation.
Okay.
Enjoyment from seeing my bestie. Just lively, but calm at the same time because we're not. Even though it's busy, the pub is busy, we're kind of in our own little corner.
Okay, let's go with that.
Okay.
Okay. What's happening now?
Now I'm actually in my room. I'm doing some costume making. I'm just sorting out some paints to paint some of the costumes that I do. I'm feeling calm in my own space, focused on what I'm doing, yet at the same time with a sense of artistic freedom. So
Freedom.
yeah.
Okay. Right. Let's go with that feeling of freedom. Yeah.
Okay.
Okay. Let's go. Okay. And now?
I'm riding a horse. I'm out with my mum actually. We used to ride a lot when I was younger.
Okay.
We've just found an open field and we've just let the horses go and we've just galloped along the field as fast as we could possibly go.
Nice.
And it's exhilarating, quite scary but also controlled, because there's trust with not just knowing that my mum's there, but I've got trust with my horse as well.
Okay, that's really good. So we're going to go back to the original memory now, the one of you diving from the high board. Yeah. Okay, so if you bring it back to the forefront of your memory. Okay. And just very quickly remind us what happened again.
Okay, so I was doing a backfall off one of the platform boards, and I was falling backwards, so I didn't have my vision of the water as I went in, and I hit the water with the force of my neck rather than my arms.
Okay.
Just a silly mistake really, but I felt that the crunch of my neck and all the muscles kind of pulling out of place, and just a bit of a horrible kind of panic as I got in the water, thinking that I broke my neck.
And so how were you feeling at that point where you felt the crunch?
Pretty panicked, very kind of scared scared of the unknown because for that split second I didn't know if I'd be able to get out of the water unassisted and if I could have drowned.
Okay. And if we were to rate the intensity of that feeling now, how would it be?
Now looking back, I think I'd say more about maybe a 2.5, 3, because I can now look at it with not I don't want to say judgmental, but what's the word I'm thinking of? Self-constructive criticism.
Okay.
So I know what I did wrong. Yes, I hurt myself, but it wasn't very bad.
Okay.
I got the right treatment within the next day in 24 hours, and 48 hours later I was completely fine.
Okay.
So now I can think of it as a way to never do that again.
Okay.
So what steps I need to take to not do that again.
Great. And now that you think about it that way, how does it make you feel?
Not as terrified to jump off. I now feel like I might actually have the confidence to try it again slowly,
Okay.
and probably at a lot lower than I started it. But I mean, before I wouldn't have even wanted to jump in the water again. But
Right.
I think I'm feeling a lot more confident. Just for now, give it a go. And then just slowly see how high I can get.
And where are you feeling that confidence in your body?
The centre of my chest moving all the way up to the top of my head. There's confidence, but I'm feeling really light as well, and especially I can now feel when earlier I was feeling like that heaviness in my neck.
Yeah.
I'm now feeling a lot lighter.
Great.
And a lot
Stay with
freer.
that, yeah?
Okay.
Okay. Ready? Great. Okay. Are you still feeling confident?
Yeah.
Yeah? Okay, so well done for working really hard today. You did really well, yeah? Okay. So it sounds like you've really started to process that difficult experience. And as I told you before, the processing continues for days. So you said that you were going to go and watch some Netflix after the session today. So definitely make sure that you do that. Yeah.
Bit of Downton.
Bit of Downton, yeah. And I'd also encourage you to continue to practice the safe place exercise that we've done. Particularly, if you do kind of find that you kind of recall that memory. Yeah. Okay. So we will kind of see you again next week just to kind of review and see how things are going. Don't be surprised if the memories do come back. Like I said, this is a bit of a process, and then we'll take things from there. But thanks very much for coming to see us.
Thank you. You've been brilliant. Thank you very much.
Thank you.